When citizens sign up for universal health coverage, they enter a clear social contract. You pay your monthly premiums, and in return, the state guarantees medical care when you need it most. That contract broke down in November 2025. Hospitals, crippled by delayed reimbursements from the new Social Health Authority, or SHA, began demanding cash up front. At Mama Lucy Kibaki Hospital, women were physically detained over unpaid bills, even though they held active, fully paid SHA registrations. By March 2026, the SHA Digital Health Agency platform simply paralyzed the system. Patients trying to access care encountered widespread digital failures and system downtimes that made verifying coverage impossible. A month later, civil servants, who had a mandatory 2.75% deducted from their paychecks, were turned away entirely from contracted facilities. These are profound breaches of a legal contract. When a public institution fails to deliver on a statutory guarantee, citizens have to step into the court of remedies to enforce their rights. A November 2025 Parliamentary Health Committee report documented exactly how this happened, identifying 19 distinct operational breakdowns across the SHA rollout. This diagram illustrates SHA's 10-stage automated claims process. It operates as an algorithmic chokehold. If a pediatrician orders hourly kidney function tests for a toddler in septicemia, the algorithm flags those life-saving, repetitive tests as fraudulent upcoding and automatically rejects the claim. Look at the final stage of this funnel. Hospitals are currently owed 43 billion shillings, while over 123,000 individual patient claims sit rejected due to administrative gaps and rigid clinical criteria. Yet, ironically, while the algorithm meticulously blocks individual patients, massive financial irregularities easily slip through the digital system. This page from the Auditor General's report shows over 32,000 claims overpaid by 647 million shillings. It also documents irregular transfers from collection accounts and reveals 1.5 billion shillings paid out to ghost facilities not even impaneled by SHA. This is a Kenyan network of cancer organizations survey showing the human cost of these systemic failures. 65.5% of cancer patients experienced severe approval delays. Many were denied treatment entirely because the system falsely flagged their fully paid accounts as depleted. An algorithm that punishes sick individuals while ignoring billion-shilling systemic theft cannot be trusted. The digital system is broken, but Kenyan law provides specific, statutory tools to override it. If a hospital bill is rejected, Section 52 of the Social Health Insurance Act gives you to demand a written, specific reason for the denial directly from the SHA Helpdesk. If the internal SHA appeal goes nowhere, Article 59 of the Constitution allows you to escalate the dispute to the Commission on Administrative Justice, the Ombudsman, for independent intervention. Sometimes hospitals resort to extreme measures, physically detaining patients in the wards when SHIF fails to process their payments. This is a direct violation of Article 29 of the Constitution, which guarantees the right to freedom and security of the person. In these cases, you can file an immediate Habeas Corpus application to secure a patient's release. If the algorithmic means test miscalculates your income bracket, Article 47 guarantees the right to fair administrative action, providing legal basis to challenge that automated assessment. This document outlines the Social Health Insurance Fund Tribunal. You have exactly 90 days from a claim rejection to file a formal complaint here, elevating your dispute into a binding legal process. Knowing these statutory levers forces an unresponsive bureaucracy to answer to the law. Individual legal action works for specific claims, but systemic failure requires collective pressure. In April 2026, the Union of Kenya Civil Servants used their collective bargaining weight to push back against the mass hospital lockouts. That organized pressure forced the Ministry of Health into an agreement that suspended strict tariff enforcement and established a joint rapid response desk to clear the backlog of patients. To prepare yourself for these failures, download our Wakati Mufulo Unakushinda remedies reference sheet, linked below. Digital algorithms have no empathy, and bureaucracies naturally resist accountability. But a legally literate, organized citizenry has the power to enforce their